Shortwave diathermy. The content of this lecture can be located within Chapter 9 in the Therapeutic Modalities text by Chad Starkey and Chapter 15 in the Therapeutic Modalities, the Art and Science text by Kenneth Knight and David Draper. Shortwave diathermy uses oscillating high-frequency non-ionized electromagnetic energy to produce deep heat within the tissues. The energy created by a diathermy unit is similar to broadcast radio waves. Diathermy does not affect motor or sensory nerves, as the electromagnetic energy that is produced does not have the wavelength duration to activate these structures. The word diathermy means through heat, from the two root words dia and therm. Diathermy uses high-frequency electromagnetic waves to heat deep tissues. Heat is produced by the resistance of the tissues. There are two main classifications of diathermy. First, a medical application, which is for therapeutic purposes, and second, which is a surgical application, which is utilized for cauterizing or burning tissue. The three types of medical or therapeutic diathermy include long-wave diathermy, which is no longer used in common practice, short-wave diathermy, which is commonly used in therapeutic treatments, and microwave diathermy. The focus of our lecture will be on shortwave diathermy. Shortwave diathermy units are expensive, ranging from $3,000 to $25,000, and unfortunately many insurance claim forms do not include billing codes for diathermy treatment clinically. Diathermy treatments are commonly used in other countries, such as the United Kingdom. Diathermy is infrequently used in the United States for several reasons. First, diathermy units are very expensive, and diathermy usage has been plagued with infamous folklore and misinformation about treatments, which is mostly due to outdated research. However, diathermy has recently started regaining some popularity within the United States as a therapeutic treatment device. The Federal Communication Commission, or the FCC, has reserved the frequencies of 13.56, 27.12, and 40.68 MHz for medical usage, with the 27.12 MHz frequency being the most common. A 27.12 MHz treatment has a wavelength of 11 meters. Shortwave diathermy forms a magnetic field in the tissues. Diathermy is a high-frequency alternating current, but since the wavelength is so very long, 11 meters, it will not depolarize motor or sensory nerves. Ultrasound and shortwave diathermy are both utilized to treat deep tissues with thermotherapy. When comparing shortwave diathermy to ultrasound, the shortwave diathermy does not get reflected by bone. In addition, shortwave diathermy does not have a beam non-uniformity ratio like ultrasound, and therefore it is less likely to create hot spots. The effect of shortwave diathermy lasts 2 to 3 times longer than treatments with ultrasound do. There is no medium required for shortwave diathermy. Shortwave diathermy can be applied over some clothing, so your patient does not have to disrobe. Shortwave diathermy, once set up by the clinician, can be administered to the patient without the clinician's presence. Ultrasound, on the other hand, requires that the clinician be present for the entire length of the treatment time. In addition, shortwave diathermy can affect a significantly greater volume of tissue than ultrasound. Remember that the treatment area for ultrasound is 2 to 3 times the size of the effective radiating area of the ultrasound head. In contrast, shortwave diathermy can treat a much larger treatment area. So when the target is a large area, such as a back, hamstring, quadriceps, or other large areas, the diathermy treatment may be more effective and efficient than multiple ultrasound treatments to treat the same size area. There are two types of shortwave diathermy generators. The first is an induction field generator, and the second is a capacitive field generator. The induction field generator uses a drum or a cable to administer treatment, and the capacitive field generator uses plates or pads to administer treatment. The type and depth of tissues affected and the subsequent increase in temperature varies between the two types of shortwave diathermy applications. The induction field shortwave diathermy is sometimes called magnetic field diathermy. Induction field diathermy is a high-frequency alternating current that flows through a coil that creates an electromagnetic field which then radiates away from the cable. The induction field method places the patient in an electromagnetic field that's produced by the equipment. The patient's tissues are in the electromagnetic field, but are not actually part of the circuit. Electromagnetic fields arise perpendicular from the cable, causing ions to oscillate and creating eddy currents. The density of eddy currents is proportional to the tissue's electrical conductivity. The friction caused by the movement of the ions produces heat. Muscular tissue is selectively heated over adipose tissues. The amount of heat produced depends on the strength of the electromagnetic field and the distance between the tissues and its source. As the distance between the tissues and the electromagnetic field increases, the strength of the field decreases by the square of the distance via the inverse square law. Induction field shortwave diathermy is delivered using either cables or drums. At the bottom are examples of A, a plastic drum housing, and B, the plastic drum housing removed to expose the coil that produces the electromagnetic field. The resulting electromagnetic field will produce a circular flow of energy similar to that of a coil. This is similar to how a microwave oven heats food. Induction generators produce the greatest amount of heat within the muscle layer directly beneath the coil. Induction shortwave diathermy is non-tissue type specific and is considered to be safer than capacitive. The most common method for induction field diathermy includes the use of a drum method. The size of the drum is approximately 200 square centimeters. The cable is coiled within a plastic drum that is placed over the target tissues. Inductive drums have built-in space plates to keep the source of the energy away from the patient's skin, which decreases the risk of burns. The drum is placed a half an inch to an inch above a towel that is placed over the target tissue. A secondary method for the induction field diathermy is the cable method. The cable method involves wrapping a conductive cable around an extremity or coiling it and placing the cable on the patient. We use a terry cloth towel to buffer the cable from the patient's skin. Because of the complexities of the setup and the potential to cause burns if done improperly, the cable method is infrequently used. This is a newer example of induction field diathermy. This is a portable shortwave diathermy called the Rebound. It's manufactured by Re-Gear. Re-Gear's Rebound is a pain management product. It's a compact, portable, and simple to use heat therapy system that generates soothing deep tissue heating. The Rebound therapy heating system weighs just under 4 pounds and is highly portable. Rebound is unique and has a frequency of 13.56 MHz rather than the typical 27.12 MHz that is commonly used with shortwave diathermy. The 13.56 MHz allows for deeper penetration into the tissue and allows the product to be lightweight and compact. Rebound can be used to treat virtually any condition where thermotherapy is indicated, including chronic pain, muscle spasms, and joint contractures. Rebound is FDA cleared and eligible for reimbursement. Rebound diathermy utilizes technology initially developed by the United States Navy to warm SEAL team members and deep sea divers. The Rebound therapeutic heating system uses a compact, low-power radio frequency generator and a family of anatomically designed therapy garments to deliver even and gentle therapeutic effects to injured tissues and to facilitate the healing process. Rebound is designed to apply shortwave diathermy through a unique longitudinal coil induction cable that is covered by fabric. The induction cable inside the Rebound therapy garment creates an oscillating electromagnetic field. The high-frequency electromagnetic energy passes through the patient's body and is absorbed by the tissues. Since the body tissue has a large number of ions, this energy causes the ions to move in various directions, creating friction. The heating effects of diathermy occur as a result of the friction between the moving ions and surrounding tissues. The longitudinal coil design allows for a uniform and gradual delivery of shortwave diathermy over an entire area. The induction shortwave diathermy only heats tissue that are good electrical conductors, such as blood vessels and muscle. Adipose tissue receives very little heating by induction fields because an electrical current is not actually going through the tissues. These units cost approximately $3,300 and each part is about $120 a piece. Compared to other shortwave diathermy units, the cost of this unit makes it more cost-effective and may be used in a clinical setting. Meet Vivi, the world's first consumer pain management product to use the deep heating and healing powers of diathermy. Vivi is currently an investigational device only and is not yet available for sale in the United States. Keep your eyes and ears open. While Vivi isn't available yet, it may be available soon. This could be the future for diathermy treatments and may allow for patients to treat at home in much the same way as TENS has allowed patients to use electrical therapy for self-treatment. Here are some of the listed specifications for Vivi. It'll be exciting to see if this becomes available on the commercial market. A capacitive field is also referred to as a condenser field. It uses the patient's tissues in an actual electrical current. When alternating current is applied to the circuit, the plates will have an opposite electrical charge, creating a strong electrical force between them. The flow of the electrical energy passes through the tissues as a series circuit, which acts as an electrical resistor and produces frictional heating. The tissue's resistance to the flow of the energy produces heating. Tissues that present the most electrical resistance, such as adipose tissue, produce the greatest amount of heat. Capacitive generators affect tissue under each plate and selectively heat adipose tissue and bone. Heating with capacitive shortwave diathermy is highly dependent on the water content and is not recommended for patients who have thick adipose tissue layers. Heat is produced by the dipole effect. Dipole molecules are molecules having no net electrical charge, but having oppositely charged ends and are randomly arranged within the tissues. When exposed to the intense electrical field produced by diathermy, the molecules rotate in the opposite direction of their charge. Positively charged molecules move toward the negative pole, and negatively charged molecules move toward the positive pole. The word dipole means that there are a pair of equal and opposite charges separated by a distance. The number of times molecules rotate each second is based on the frequency of the current. The high-frequency current, such as used in shortwave diathermy, produces rotation that creates kinetic energy, which is then released as heat within the tissue. The current flows along the path of least resistance, concentrating heat on the superficial tissues. The capacitive method is not recommended for patients who have larger layers of adipose tissue. Capacitive shortwave diathermy is administered using either the plate method or pad electrodes. The plate method is similar to the induction drum. It has metallic coils or plates that are shielded by plastic that are then applied to the target tissue. An electrical charge builds on each plate until it discharges to the opposite one based on the unit's output frequency. A unit of 27.12 MHz would repeat this cycle 27,120,000 times per second. The plates need to be spaced equal distances from the body on each side, otherwise they may result in uneven heating. The plates should be stationed approximately 3 centimeters away from the body on each side, and the patient should be really still during the treatment. In the pad method, the pads are placed in contact with the skin. To provide uniform heating, pad electrodes require even more contact pressure and a uniform distance from the skin, otherwise burns may occur. The pads are placed on the skin on either side of the target tissue. To prevent the density of energy from becoming too great, these electrodes must be spaced at least their diameter apart. Most of the heat is produced near the source of the shortwave diathermy unit and just below the adipose tissue or muscle interface. Increased adipose tissue thickness will reduce the rate and magnitude of intramuscular heating. Capacitive is not recommended for patients who have large layers of adipose tissue. The amount of heat produced depends on the strength of the electromagnetic field and the distance between the tissue and its source. As the distance between the source of the electromagnetic field and the tissue increases, the strength of the field decreases by the square of the distance. The inductive shortwave diathermy ends up treating superficial muscle. Capacitive shortwave diathermy treats mostly adipose and bone. In comparison, ultrasound treats more collagen-rich structures like tendon, ligament, joint capsule, scar tissue, and fascia. Please remember the inverse square law as we have previously discussed. This law states that the intensity of the energy striking the tissue is inversely proportional to the square of the distance between the source of the energy and the tissue. The inverse square law is calculated by taking the distance squared and dividing it by 1, which will equal the overall intensity. The formula is I, intensity equals 1 divided by the distance squared. The cosine law states that as an angle deviates away from 90 degrees, the effective energy is reduced by the multiple of the cosine of the angle. This is calculated as the energy multiplied by the cosine of the angle, which equals the effective energy. A deviation of plus or minus 10 degrees is considered within acceptable limits for therapeutic treatments. In other words, electromagnetic energy is most efficiently transmitted to the tissues when it strikes the body at a right angle or a 90-degree angle. When the treatment angle is not perpendicular, the resulting energy becomes more and more reflected with the greater the treatment angle. Treatments at a 90-degree angle are 100% effective. A treatment at a 60-degree angle would only be 86% effective, and a treatment at a 30-degree angle would only be around 50% effective. With the use of shortwave diathermy, there is a slight risk of a fire hazard. This is mostly related to the clothing choices of the patient and then the application of diathermy. Although the risk of fire is relatively low, it is something that needs to be considered and discussed within the application protocol. There wouldn't be much worse than setting your patient on fire. You're pretty much guaranteed not to have them return for treatment. Clothing options that are best for diathermy application are materials that are made of cotton. Any plastics, fabrics, or certain synthetics that are made from nylon, polyvinyl chloride, or polyethylene tryptophthalate pose a risk for fire. Use common sense with your patients and the application of diathermy. Properly positioning the patient and being aware of your surroundings can help prevent this fire risk. Keep all cables at least several inches away from other objects in the clinical setting as well to help reduce the risk. Shortwave diathermy can be delivered either continuously or in pulsed forms. The idea of the continuous and pulse settings are very similar in theory to ultrasound. The biggest difference is that the heating is more aggressive. Continuous shortwave diathermy increases the temperature of subcutaneous tissue and is generally used for chronic injuries. The continuous treatment utilizes higher intensities and causes a more rapid temperature increase. Pulsed shortwave diathermy produces both thermal and non-thermal effects. We use a lower intensity and the machine has distinct on and off times. This pulsed shortwave diathermy protocol is commonly used with subacute and acute injuries. Generally, in pulsed diathermy, the off time is considerably longer than the on time. pulsed shortwave diathermy seems to be the best of both worlds, offering both thermal and non-thermal effects. The pulse width, also called the pulse duration, is the on time required for each pulse to complete its cycle. The interval between the pulses is the off time. A wide pulse generates more tissue energy than a narrow pulse. Commonly, we use a wider pulse, which increases the energy and increases the thermal effects. The pulse width is commonly set at 20 to 400 microseconds. The pulse frequency is higher. This is the number of pulses that are delivered per second, or PPS, in hertz. The greater the number of pulses per second, the more energy is produced. This helps to increase the thermal effects. A typical pulse frequency would be between 10 and 800 hertz. The power, or the intensity, is a function of both the pulse width and the pulse frequency. Shortwave diathermy with a long pulse width and a high pulse frequency generates more power than a short pulse width and a low pulse frequency. This is measured in watts and equals the total energy that is applied to the tissue. The higher the wattage, the more increased energy and increased thermal effects of the treatment. We can see by this chart that pulsed shortwave diathermy can be manipulated in different ways. We can see at the very top continuous shortwave diathermy. The bottom two graphs indicate different types of pulsed shortwave diathermy. Shortwave diathermy treatments last approximately 20 to 30 minutes. We should only schedule one treatment every 2 hours for the patient. The treatments may be repeated as needed for 2 weeks. When higher temperatures are used, it's recommended to decrease the treatment time to 15 minutes. Always use a dry terry cloth towel to cover the patient. This has several functions. First, it provides proper spacing, but it also absorbs any perspiration on the skin. Any water is going to add to the intensity of the heat. So if someone sweats profusely, the towel may need to be changed during the treatment. The towel should always be dry. Unfortunately, this device has to be used by itself. We cannot use shortwave diathermy in conjunction with any other device such as electrical stimulation or moist heat packs. The physiological effects related to the application of shortwave diathermy include both thermal and non-thermal changes. The effects associated with thermal treatments include deep heating. Shortwave diathermy can heat intramuscular temperatures to a level of 4 or 5 degrees Celsius. We see an increase in blood flow, tissue extensibility, and cellular metabolism, and there is associated muscular relaxation. The effects associated with non-thermal treatments include improved tissue healing, including open wound healing, and edema reduction. We need to be careful that the open wound is not wet. It cannot be seeping any sort of fluid, otherwise it's going to increase the tissue temperature too much and will actually cause an opposite reaction. The non-thermal treatment also helps with edema reduction. The indications and contraindications for the use of shortwave diathermy can be found on page 211 and 212 within the Starkey text. The indications for the use of shortwave diathermy include acute, subacute, and chronic pain, subacute and chronic inflammation, range of motion restrictions, muscle spasm, edema reduction, fracture healing, hematoma and contusions, sinusitis, and venous stasis ulcers. The contraindications for shortwave diathermy, in addition to the general contraindications for heat, include metal, plastic, and cement, impaired circulation or sensation, blood clots, fever, cancer, pacemakers, sensitive areas such as the genitals and face, pregnancy and menstruation, acute injury, especially for thermal treatments, or over large regenerating nerves, especially for the thermal treatments again. There are many precautions for the use of shortwave diathermy. A more thorough list can be located on page 212 within the Starkey text. But some of the most important precautions include removing contact lenses when applying shortwave diathermy around the head, face, and eyes, Individuals who are pregnant, may be pregnant, or who have implanted electronic devices should not be permitted within 50 feet of the unit. To avoid overexposure, a distance of 3 feet from the source of energy should be maintained to ensure the operator's safety. The skin should be covered by at least a half an inch of toweling, and do not allow perspiration to collect on the skin. The biggest precaution with the use of shortwave diathermy is to make sure that there is no metal within the electromagnetic field. There are a lot of metal objects on people. Some of the most common ones to look out for are jewelry, body piercings, watches, belt buckles, zippers, metal underwire bras, hearing aids, orthodontic braces, dental fillings, artificial joints, and internal or external fixation devices. Pulsed shortwave diathermy may be used over metal implants that are not circular in shape. It is best to consult with the user's manual and make sure that you are comfortable with their guidelines prior to treatment. This is a table that suggests the dosage parameters that are recommended for the use with pulsed shortwave diathermy treatments. This table can be located on page 210 within the table 10-1 in the Starkey text. Please consult with this table for dosage, temperature sensations, and indications, as well as settings and parameters for different treatments. These treatments include non-thermal, mild warmth, moderate warmth, and vigorous heating. This table compares thermal ultrasound to shortwave diathermy. I would encourage you to look at this table located on page 201 within the Starkey text for reference. Ultrasound uses acoustical energy, while shortwave diathermy uses electromagnetic energy. Ultrasound heats collagen-rich tissues such as tendon, ligaments, fascia, and scar tissue, while shortwave diathermy heats adipose tissue and skin via the capacitive method and muscle and blood vessels via the inductive method. The volume of tissue available for heating is nearly 10 times larger in shortwave diathermy than ultrasound, with a 200 square centimeter capacity compared to 20 square centimeters respectively. The temperature increases seen around ultrasound is less than that of shortwave diathermy. For a 1 megahertz ultrasound treatment, more than a 6.3 degree Fahrenheit temperature increase is available, and in 3 megahertz ultrasound treatment, more than a 14.9 degree Fahrenheit temperature increase is available. With shortwave diathermy in the capacitive method, greater than 7 degrees Fahrenheit temperature increases are available, which are targeted to treat fat. And with the inductive method, more than 18 degrees Fahrenheit temperature increases are available, which help to treat muscle. One of the biggest differences between the two units is in the amount of heat retention. For ultrasound, we have a very short window available to retain the heat and to treat the tissues. We have approximately 3 minutes after the treatment is conducted to perform joint mobilization or tissue elongation practices before the tissue cools. With the use of shortwave diathermy, the heat retention window is tripled to 9 minutes. This gives the clinician more time to work on the tissue extensibility exercises, joint mobilization, and stretching with the patient, and may result in a greater increase in the tissue extensibility. Please make sure that you complete quiz number 11. The quiz is worth 10 points, and you will have 10 minutes to complete it.